Um, okay, delving into the concept of socialized medicine, Medicare for all. There's no way I want to see it in this country. We are not a homogenous society here in this country. We do not have um, a homogenous group of individuals living across this great nation. We don't, in any way, shape, or form. I actually love that fact, by the way, but it's one of the main reasons that socialized medicine could never work. Um, because there's no way that a one size fits all approach, which that's what socialized medicine really boils down to, is going to work. It can't work that way. Every element of socialized medicine at this point in this country that we have is a complete disaster. Almost unbridled. The fact that we also have a CDC, a FDA, and a USDA that is completely corrupt, and therefore would be there to some degree in charge of, as they already are in many ways, Medicare, Medicaid. That's one of the biggest things that, to be honest, is frightening to me in terms of this concept and why I consider it so perverted, so evil. These are the garbage pieces that brought us chemtrails, that brought us pesticides in our water supply, and oil in our water supply. And now I'm being asked to consider the construct of, you want me to trust them with healthcare for the entire country? Are you out of your freaking mind? No way. I have Medicaid right now. I almost never visit a doctor. I don't even try at this point to use the things that I actually do need in terms of things that are covered, because I know that it's cheaper to order the darn stuff on Amazon. Okay. And pay by credit card. And that's what I do. Because that way, for the most part, I'll get better quality, or at least the same. I know here and there you might actually be able to, if you go through full rigmarole, get some stuff that's better quality than Amazon. I'm not going to deny that. Especially the stuff that for now I'm purchasing to get better quality stuff from there later on, alright? But again, there's no way that I want to see socialized medicine in this country. No. In order to get, by the way, the braces that I need, and I'm just going to go through the thing that I would have to go through in order to just get what I've already bought in cash. And that would be that I would have to go to a primary care physician, then get the referral to see either an orthopedist or a sports medicine doctor for an initial consult. And then in theory, they could send me just straight to the joint fitter, and then the fitter would then fit me, and that would be about eight visits, okay, for the 5 things that I have right now, and that's at best. If they fitted me and then sent me out that day, which, if you're talking about better quality joint braces, they would actually need to spend their time, and it would be a 2 or 3, which is to say a custom fit. That would be at least 2 visits per set of braces. So that would be the 13 visits instead of 8, and therefore $78 minimum as opposed to $48 minimum. But to be honest, another thing that I've gone through many times is that the orthopedist and the sports medicine doctor generally won't, even if I bring them old scans, they still won't take my word for it, what I need. So they'll then send me to get a set of MRIs and or CAT scans done. And they'll send me to one per set because insurance will only cover in general one test at a time. So that would be 5 sets of scans. Okay, hips, wrists, elbow, knee, okay, and ankle. So that's okay. And I also need finger ones. Eventually, I'll get those. But again, for every single one of them, they'd send me to get either CAT scan, MRI, or possibly X-ray. Maybe ultrasound, which if they did the ultrasound, they might even do that in the office. There's a chance. But you're still talking about between, at best, 8 visits to get this rigmarole done. And by the way, you're also talking about, at best, a year to get every single one of these phases completed. Okay? Which is why I consider it an obscenity. Why I consider it so insanely ridiculous that people are telling me, yeah, Medicare, it's great. You're freaking nuts. You have some screws loose if you really think that Medicare is wonderful. Again, I live below the poverty line. So it's not like I have a load of cash to spend, to put it mildly. I don't. Okay? When I get these joint braces and I pay quote-unquote cash, which is to say credit card, I have to skip meals in order to do that because the food stamps aren't really quite enough. So I often have to cut out food in order to get this. And I'll do it again, by the way, whenever I need to. Because the bottom line is that it's cheaper and it's safer. Because the $48, the $80, those are just in public transit costs locally, which locally public transit's pretty freaking cheap. That's not including what it would really cost often, because these trips would take me all day long, and therefore unless I went without eating for 8-12 hours, which I've actually done anyway, but let's call it for the concept of being humane, because many folks are saying be humane. Well, okay, humane. If I'm away from my apartment for 6 to 12 hours, which is pretty frequent, I'm going to want to eat something along that route. I'm going to want to go, and I should be able to go and get a quick bite to eat. And I'm not talking, and I've never, by the way, spent like $100 in terms of food, eating it, even in the 5 boroughs of New York City. Whenever and at times I've had to, because I've been so debilitated, gone out to eat during one of these journeys to try to get medical care, and I've still tried to do it a couple of times. Mainly because it was for paperwork, by the way, for food stamps or something else, because beyond that, I haven't even tried much. I have to be honest. I've hit so many dead ends, that, it's too much, and, so I've dealt, and again, keep in mind, it's not just even Medicare or Medicaid. It's the concept of, to me, insurance as a whole, health insurance. It doesn't work. To me, it absolutely doesn't work. It treats everyone as if they are absolutely identical, and they're not. There are some people that actually do react pretty positively to standard medications. I'm not one of them. My body responds atrociously to most standard medicines. I mean, really. I've gotten all kinds of allergic responses, okay? And then I've had many of them that just plain don't do a damn thing. And that's pretty well what I've experienced in terms of trying to deal with pain management. So that's and that's why I've developed this attitude towards it, is that, and oh, by the way, it's not like this is a new set of battles for me by any stretch of the imagination. I started trying to wrangle insurance companies to get reimbursement for things that were supposed to be covered when I was about, on the phone, granted, when I was about 9 or 10 years old. Okay, folks, so I'm more than, I'm over 30 now. Alright, no, I'm not even 35. So, but I've still been wrangling with insurance companies, both Medicare, Medicaid, and United Healthcare, U.S. Healthcare, a bunch of, I think I've even wrestled once or twice with Cigna. Again, they're all the frickin' same. And they're all a frickin' disaster. What it says is covered. In theory, it might be covered, but you have to go through so many frickin' hoops, go to so many follow-ups, go to so many doctors, and that's visits, even. And that's even if you have a doctor that's willing to work with you. Okay? If you have a doctor that's willing to work with you, it'll still take you months to get these things done. And that's, again, you have a great doctor, you know what's wrong, and it's listed as being covered by insurance. Okay? It doesn't work, folks. It doesn't frickin' work. And I know I'm not the only one that suffered in this way. With my particular mainstay of my condition, Ehlers-Danlos joint hypermobility, it's not unusual for people to take more than a decade to get diagnosed with this condition that we're born with. Okay, I'm a little bit unusual. It didn't just take me 10 or 15, it took me more than 20 years of symptoms. In fact, I think about first sign of actually should have been, the first signal was when I learned to walk, took my first steps at the age of 2. So this has been something that's lifelong. What we really need is a new kind of system, and I'm going to try to articulate an actual new system if I can, which I really think would be better. And it's not a full-on system, I'm going to be honest, but it's a matter of the fact that we need to get a new compilation of ideas out there. And it all starts to me with fixing the FDA, USDA, which is the Food and Drug Administration, the U.S. Department of Agriculture, and the Center for Disease Control. Because, and by the way, if we can first get those things under control, working properly, then there's a chance that I could at least consider socialized medicine to not be a total death trap. But at this point I can't.